Good afternoon, everybody. My name is Christopher Muther. I'm the travel writer for the Boston Globe, and thank you so much for joining us today. Today, we're going to talk about travel, safety, when we can travel safely again. And I know we're all aching to travel, especially given how lovely the weather has been lately. I'd love to introduce our all-star panel for today. Let me start with Gloria Guevara. She is the CEO and president of the World Travel and Tourism Council. Gloria, thank you for joining us. Let me also introduce Jessica Nabongo. She is the founder and CEO of Catch Me If You Can. She's also a travel writer, influencer. She pretty much does everything that I can think of. She's also the first Black woman who has traveled to every country in the world. So there's something we can all aspire to. And finally, we have Dr. Abrar Karen. He is a global health specialist from Brigham and Women's Hospital. Thank you all so much for being here today. I think I wanted to start starting with Gloria. Gloria has a broader perspective on travel. And while we're all currently focused on kind of where our trips are and when we can travel again, I would just love to hear from Gloria about the impact that COVID-19 has had on the industry itself.
Thank you, Chris, for inviting me, for having me in this forum so important, and great to join with two experts as well, the conversation. Travel and tourism contribute to 10% of the global GDP. We at WTTC, we do a lot of research and we quantify the impact of 185 countries around the world, as we also represent the global private sector. 1 in 10 jobs in 2019 depended on travel and tourism. That's 330 million jobs around the world. And pretty much every single country around the world had some benefit from tourism in 2019. Now, what's very important when you look at all the jobs created in the last 5 years before COVID, every single year, including all the industries and all the sectors, 1 in 4 jobs were the contribution from travel and tourism. Now, last year, it was, as we know, totally unprecedented, the worst crisis ever. Unfortunately, 174 million jobs around the world have been impacted. That is a number that you cannot imagine, but that is huge. A lot of women, 54%, of course, of our sector are women. A lot of youth, 30%. And as our sector is very inclusive, has impacted every single group that you can imagine as well. $4.8 trillion, that's the loss from last year, as travel international was down 65% and 33.5% domestic overall. So this is totally unprecedented, bigger than 9/11 and the financial crisis combined multiple times. And unfortunately, also the social impact has been devastated, because it's not only lives and jobs, of course, we're talking about livelihoods, food on the table, and for countries that depend greater than 50%, even 70% of their GDP on travel and tourism, this has been the worst crisis ever.
Yeah, from all accounts that I've heard as well, it's just been devastating across the board. Before I continue, I realized I forgot to say a couple of important housekeeping things. One is that if you have questions, there's a Q&A tool at the bottom of your screen that you can use. Also, you're all muted and we can't see you. So you can do whatever you want. Just don't say mean things or make faces at us also, this event is being recorded for those of you who want to go back and look, or if you missed the session today. So that being said, I'd like to turn to Abrar, and a lot of the questions that we've gotten from readers before the event happened are very specific about health, the vaccine, and when travel can resume. So I wanted to clarify with you a few things about travel once you're vaccinated. I think a lot of people have the sense that I have a vaccination, I can go anywhere I want now. What are your thoughts on that?
Yeah, thanks, Chris. Really important point. And, one of the key things that everybody is wondering is when can life go back to pre-pandemic life? And what can I do after I've gotten the vaccine? So I am hopeful. Just earlier this week, the CDC actually released some new guidelines for people that have been vaccinated in terms of their quarantine requirements. So if you've been vaccinated if you're in a 2-dose vaccine series, if it's been 2 weeks since your second dose and within 3 months of that dose, you don't have to quarantine if you've had an exposure to somebody with COVID. Now, as long as you don't develop any symptoms, if you develop symptoms and you get sick, then they recommend quarantining, getting tested, et cetera. But if you feel fine, then you don't have to. And that's huge, because we've been living for the last year with this notion that, if we have any kind of exposure, that means we have to be home for the next 10 days to 14 days. And this is obviously a huge disruption on our lives. And there's also this continuous worry, am I going to get really sick? Well, now with the vaccine, it addresses both of those. The other part of the equation, though, is what to do in terms of traveling once you've been vaccinated. And the guidelines for travel actually are the same as they were before you got vaccinated. And the reason for that is that not everybody's vaccinated. And so while you're protected, you can still transmit to other people, although it is going to be less than before you got vaccinated. There is still some onward transmission, and we want everyone to get vaccinated so that we can all sort of interact safely. And so that's really the key point here.
It's interesting because I think a lot of people do feel as if once they're vaccinated, the world is their oyster again, and they can go anywhere. Gloria, I wanted to ask you about the idea of kind of the broader picture for travel internationally. I know that a lot of people are wondering, once they're vaccinated, can they get into another country? Will things return to as they were in 2019 before the pandemic? What have you learned with your talking to people around the world?
Thank you for the question. Well, first of all, let me tell you that, and I'm going to be here totally direct. First of all, things are not going to go back they're not going to be back as we were in 2019. I think you will see things better in many capacities, like sustainability, the digital world, but we need to learn to coexist with this virus. Unfortunately, we have a limited supply, and while we're very fortunate in many countries to have a very aggressive vaccination rollout, there are many countries that they don't even know when they're going to get the vaccine. That being said, you can also travel without a vaccine. I have been traveling. I just arrived today from Saudi Arabia. As long as you have the good protocols in place, as long as you have testing before departure, testing on arrival, some things in place that would allow you to reduce the risk as much as possible, and at the same time wear the mask and all the things that we know, I think that we can coexist with this virus. But we need to learn to coexist, because this is not going to go away. And we need to think about also the 7 billion people around the world. It's going to take a while to vaccinate 7 billion people. It's going to be years. And then by that time, you might need the second doses, the second year, and the third and the fourth. So you need to respect the protocols. You need to follow the advice from the medical experts. And we believe that we can travel. We have seen that in many places around the world. Some countries are doing better than others. But what's very important here is that we all are part of the solution. As long as we follow the protocols, we respect the rules, you can resume travel. For instance, I live in Europe. I'm speaking from London. I was able to travel during the summer. I went to Greece. I can tell you that within the private sector, we have been able to implement protocols, as we learned since 9/11, that is crucial to have the same protocols. We follow the guidelines from CDC, from WHO. You have these protocols in the airlines, in the airports, in the hotels. And it was a great experience that I had with my family in Greece. Yes, we have to wear the mask in the flights, which is fine. And we have to use sanitizer, and we have to respect all those things. But we were able to have a great holiday in Greece, as an example. So my recommendation here is, while you're lucky to get the vaccination, try to get it as soon as possible. But at the same time, if you want to travel, you still have to respect the protocols globally. And we need to resume international travel with the same rules, so that everyone can benefit from the sector.
Well, I have you here, Gloria. I wanted to ask you, because this is a question that came up from many readers. Do you foresee in the future some sort of digital or international passport for vaccination? Right now, people in the United States who get vaccinated get a card from the CDC. It seems like it'd be very easy to photocopy and fill out and move ahead. Hopefully people wouldn't do that. But I'm wondering what you've heard about what we can expect going forward.
That is a great question. And let me just clarify it a little bit for difference, because there's also misunderstanding. One thing is the health passport and something different is a health pass. A health passport has all your information of all your vaccinations, like from chickenpox, every single thing that you have received, and all your medical conditions. There are some yellow books that we used to have in the past for international travel that we call health passports. The reality is that WHO is not in favor of those health passports because you have a lot of your private data and information, and we don't believe that you need to share all your history every time that you're traveling to a country. However, health passes are different. If you need to have a test, a COVID test before departure, which is what we suggest in order to avoid exporting the virus, it's nice to have the results of that COVID test in an app in your phone, and that can be scanned in the airport if you're making an international trip. Same situation if you need that on arrival, or if you have been vaccinated, that should be synchronized and you can have your vaccination instead of your test results, for instance, in the app. The challenge that we're facing right now is that there are a lot of apps out there, and we have an initiative in the private sector to connect the app so that we can have the interoperability needed and make it easier for the government. So we are in favor of health passes because, as you say, these certificates can be unfortunately duplicated or just print out. But if you have that synchronization with an app and in real time, that would help you through your journey and make it seamless, also and touchless and less paper, which is what one of the benefits that we have accomplished from the last years.
Excellent. Thank you. Thank you so much, Gloria. Jessica, as somebody who has been out in the world, we spoke of this. You've curtailed your travels dramatically over the past year, but you have traveled. Have you felt safe in your travels? And what have you done to ensure the safety of others?
Yeah, that's a really good question. Thank you. So since we've been, let's just say since March of last year, I have taken around 40 flights between March of last year and now. And I have felt completely safe. Some caveats. I've only been flying Delta Airlines, which offers social distancing on the plane. For me, that's important. For me personally, I don't feel safe sitting directly next to someone just yet. But I feel safe flying on Delta. The other thing to remember is that Delta is testing everyone that works for them 3 times a week. And to me, that shows that it is safe, because if it wasn't, then there wouldn't be as many flight attendants anymore, right? There would be a massive call for new flight attendants, but we're seeing that's not happening. So I do believe that flying is safe, and I'm sure Dr. Karen may chime in here, but I personally believe that flying is safe. I came back from Dakar last week. I had my mask on for 20 hours. Of course, I'm sneaking food up, I'm drinking and things like that, but I had my mask on for 20 hours in transit. I'm fine doing that because I want to get out and travel and explore. Other key things that I've been doing to keep myself safe, as Gloria mentioned, I'm testing often. I've tested over 15 times. I've tested to enter countries. I've tested to come back into the US. And so testing is definitely going to be key for us to be able to coexist. Also, of course, I always have multiple bottles of hand sanitizer at my disposal. But I just want to say that masks and social distancing work. I have a ton of friends who've gotten COVID this week. 3 more of my friends have tested positive, and I still haven't, because I don't allow people in my home unless they've tested. If people are in my home, even if they've tested, we still sit apart. I open a window. As far as travel, everything I do is outdoors. If I'm indoors, it's a grocery store where there's very high ceilings, a limited number of people. But the most important thing, I believe, is wearing your mask and social distancing. One question I know that came up constantly and has come up for me is people are constantly asking me about hotels and what I do when I go to a hotel to make sure I'm safe. I personally don't do anything. I choose hotel brands that I feel comfortable with. And I actually wanted to ask Dr. Karen a question about this, because I know in the beginning there was a lot of fear around catching COVID from touching a surface and touching your face. Can you just speak a little bit about that? Because from everything that I've read, it seems to me that it's really human to human transmission, as opposed to going into a hotel room, hours after someone else has been in there.
Yeah, thanks. Jessica brought up a number of really, really important points. So I'll address this last point first. What you're talking about is fomite-based transmission. So if an object becomes infected and then somebody else touches that object and then they touch their oral mucosa or their eyes or something, and then they get infected, we epidemiologically have not seen a lot of transmission from this route. We primarily are seeing transmission through the air. So whether that's in the form of droplets, which are infect people at shorter distances and drop to the ground, or aerosols, which are smaller particles, hang around in the air and play a bigger role when you don't have good ventilation indoors. That's really where we are focusing on transmission. And so this, there's been a lot of focus on cleaning and objects down. I think it makes people feel like they're doing something. But some of this is hygiene theater, which is really to say that you think you're getting protected, but actually you should be focusing on the air around you, the shared air that we have. I completely agree that physical distancing and masking is essential. Those are the two biggest things that you can do. The epidemiology of COVID has shown us that actually it's duration of time around somebody, distance between people, the space that you're occupying, if it's well ventilated or not, and whether or not you have personal protection on, namely wearing a mask, a well-fitted mask, a mask that has good filtration. Now, I will say that when I think about if something is safe or not safe, I don't think of it as a binary. It's not, oh yeah, safe and this is not safe. I think of it more as a continuum of risk. This is more safe, this is less safe. Even in a less safe situation, you may not get COVID and somebody else might. Even in a more safe situation, you may get COVID and a lot of people may not. This is all just a risk-benefit analysis. And so when we think about even traveling, it's the same thing. What am I traveling for? What's the reason? What precautions can I take? How sure can I be of the mode of transmission or the mode of transportation I'm taking, the hotels that I'm going to, the people that I'm going to be around? It's like defensive driving. You can only do so much, but you can't control every situation that you're going to end up in. A really good example, actually, a very interesting epidemiologic study was transmission on a flight from Dubai to New Zealand. This was published by the CDC. This described a flight from September, and it really highlights actually a few things that on the flight itself, there were a number of moments where transmission happened. We don't know exactly at which moments, but we know there are vulnerabilities in the safety protocols that happened there. So not everybody was wearing a mask. Some of the passengers that were wearing a mask still got infected and some did not. This is of course self-reports, and maybe they took the mask off briefly to eat or drink or when they went to the bathroom. We don't know that. There was a time where the plane was off, so the ventilation system was off for 30 minutes when they were refueling. That could have contributed to spread. The index case actually said that they had been tested before they got on the flight and they had a negative test, but the test was 4 days before the flight rather than 2 days before the flight or 1 day before the flight. Had they tested sooner before their flight, they may have tested positive and the outbreak may never have happened. So there are multiple layers of preventing transmission. When many of those layers fall apart, transmission is more likely to occur and can occur. So I'd say those are a couple of points related to some of those topics.
Well, we have you here, Abrar. I wanted to ask you a lot of the questions that we've received from readers/viewers are people want to know essentially when they can travel again. There's lots of specific, when can I go to Paris? When can I go to Aruba? Those sorts of things. And I know that there's no crystal ball that unfortunately can tell us those things, but I'd like to hear from you as an expert. But actually, before you answer that, I wanted to ask you, have you done any traveling in the past year?
Yeah, so the only traveling that I have done is from here to Los Angeles, where my family is, sort of to help out with family things at home. But beyond that, I've not done any other travel. In fact, all of the global health travel that I would normally have been doing, I was not able to do this year. So mostly I've been focusing on public health work here in Massachusetts, and then to LA County, where I'm hoping to help out a little bit on the COVID response as well, waiting for my California medical license to come through. But yeah, that's the only travel I've done. And I, I agree with what Jessica was saying. I also tried to fly Delta, where the middle seat is blocked off. So I haven't had to sit directly next to anybody on the flight, which was reassuring to me. Also, wearing a well-fitting mask or a higher filtration mask is another key intervention that one can take. Thankfully, I've had both doses of my vaccine now. And so the most recent travel I've done was after both of those doses.
But then I also wanted to go back to the, go back, am I muted? Sorry.
No, you're.
Okay, good. I wanted to go back to the idea of when people can travel again. So you've been vaccinated. You said essentially once you're vaccinated, there's still a chance you may be capable of shedding the virus.
You can still get infected and you can still transmit onwards, but remember, onward transmission is significantly reduced when you're wearing a mask. That's also a part of source control with masks, where if I happen to be infectious and I didn't know it and I didn't show any symptoms because I've been vaccinated and I'm a younger person, wearing a mask in these kind of close settings is a way to protect people around you as well. The other point that I think is really important is this: there's been a lot of inequity in the vaccine distribution, both within the United States and globally. And so wealthier countries and wealthier pockets within countries are getting the vaccine at much higher rates than more impoverished places or impoverished people, who many of them are frontline workers. So when we think about the privilege of being able to go and take an international trip, you also wonder, okay, well, who are the workers that are making that possible in the travel industry? Who's working at the hotels? Who's picking up my bags? Who's transporting me to the airport? Am I putting those people at risk? And am I worsening inequities because these are frontline workers who may not have been vaccinated, even though I have? And that's something that, from a moral and ethical standpoint, it weighs heavily. I also understand the travel industry brings livelihoods to many, many, many people. And so this, again, gets at the notion that we need to protect our frontline, most vulnerable people, get them vaccinated, financially protect them, et cetera, both in the US and globally.
Right, exactly. Sorry, go ahead, Jessica.
I just wanted to pop in here. And, I'm not a medical doctor or an epidemiologist, but I just want to say, there's ways to travel now. Gloria spoke extensively about how many people are employed in the tourism industry. In some countries, literally rely on tourists and are suffering because they don't have access to tourism. And so one thing, if people are trying to figure out where they can go, IATA has an amazing map of the entire world that has all of the entry requirements. So if you literally Google IATA International Tourism, IATA International Tourism, you'll be able to pull up this map. And so while there are certain countries that Americans can't go to right now, there still are a lot, particularly in the Caribbean, some African countries, very few Asian countries, but there are still a lot of countries that you can go to. It's going to require that you test. I think it's important, Dr. Karen spoke about it, it's important when you do test that you then quarantine. You can't go get a COVID test and then go to Target to prepare for your trip. You should really focus on getting that test and then quarantining so that you're not picking up COVID between your flight and when you take that test. But I personally think that there are ways that you can travel. There are countries that are allowing people in, but again, it's about wearing your mask, social distancing, and being respectful of frontline workers who do still have to interact with you. So just making sure, even if they aren't, making sure that you're keeping the distance necessary to keep both parties safe.
Exactly.
Chris, can I come in? As
Please.
Jessica mentioned on the IATA, there is also another piece of information that IATA shared not that long ago. And I don't know if you saw the report that they had, I think they reported like last year, there were like 1 point something billion people that travel around the world. And they were able to track, I think was like, if I recall correctly, 44 cases of people that got infected. And this was before the protocol of wearing the mask. Because as the doctor mentioned and Jessica also reinforced that wearing the mask is not only for your own protection, is for everyone. And that, I think that's the most important component probably of all the protocols. The other thing that I wanted to say, I have flown with United, by the way, and American Airlines and British Airways, and I felt totally safe because they ask you to wear the mask the entire flight, and they give you sanitizer, and they follow all these protocols and rules that are standards, and in conjunction with all the information that CDC provided. Now, let me just comment really quick, if I may, on the hotels. It's something very interesting is that if you recall, when we had the worst of the pandemic, a lot of our hotels offer rooms for free to doctors and nurses to stay. Like, for instance, not only New York, but here in Europe and in Italy, in Spain, everywhere we offer rooms for free to doctors and nurses who were taking care of patients with COVID. And based on the knowledge that they acquired from CDC, WHO, and many others, they were able to maintain those premises COVID-free. Okay, and that knowledge went to the protocols that we defined. So the other recommendation that I want to make, besides what Jessica mentioned, that I think is very important, is that we have been talking to a lot of governments and destinations and in the private sector implementing these very high level protocols. And for the destinations that they have implemented similar protocols at the level of the highest level that we have defined, we are recognizing them and giving them something called safe travels, which isn't a stamp, it's just a recognition. And you can find that with your travel agent or with OTA or whomever you book your trip. But it's very interesting to identify the destinations that they have implemented these protocols, because it means that they are following the rules from CDC, from WHO. Everyone is wearing the mask, they have the sanitizer, they have contact tracing apps, they do testing and all the things that we need. And there are a lot of places where you can travel, as well as Jessica mentioned, Mexico is also one of those, and also many others.
Gloria, let me ask you, we spoke a little bit about this before we started, but the idea of living with the virus, traveling with the virus, do you see at any point this year of people kind of becoming more comfortable with the idea once they're vaccinated, once they're wearing hopefully masks, all of those things? Do you see a return, let's say this summer? I just wrote a story where a lot of people were saying they're hedging their bets that by the summer they'll be able to travel. I'm wondering what your sense is about that.
Well, we're seeing a lot of things happening. Not only what the doctor mentioned, a very aggressive, massive rollout of vaccination in the Northern Hemisphere, especially in some countries, developed countries, as he mentioned, that is helping to reduce mortality. For instance, in the case of the UK, they have targeted 100% of seniors by mid-February, which is going to help in reducing the pressure to the hospitals and the mortality. And the same in Europe and, of course, US and many other countries. Now, at the same time, as I said before, to vaccinate the entire world is going to take years. So we believe that you will see a strong summer, and we're seeing reservations already starting in April. And the reason is because people are very tired, right? We are tired of lockdowns. We're tired of not enjoying life. Jessica has been able to travel, which is fantastic. And there are a lot of benefits. There are a lot of service around the world. And one of the three things that make the human beings happier is travel, that socializing, that connection with cultures, that empathy, that understanding. And at the same time, when you travel, you help to share the income between developed and developing countries, and you provide a significant social impact and opportunities to so many people. So it's something that is nice to do, not only for you and your family and your loved ones when you can have the best memories, but also for when you visit the destinations, you really make a positive change and a positive contribution to the destination. So that being said, I have heard and I have seen a lot of people that if they didn't travel last year because of COVID, this year they're planning to travel twice or three times. So we're hoping to have a strong summer. The challenge is going to be, to tell you the truth, the offer, because unfortunately, a lot of companies have gone out of business. A lot of people have closed there, especially the SMEs. Let's remember that 80% of the businesses in travel and tourism are SMEs. So if a hotel, unfortunately, goes down, you have a lot of SMEs around that they are impacted. And a lot of SMEs, as I say, they're owned by women and they are owned by families. And unfortunately, that impact is going to be very hard to recover. So you might be in the situation that you're not going to have a lot of offer in some cases. Let's hope it's not the situation, but starting in April, we're seeing bookings and we are expecting a strong summer and a strong recovery.
That's excellent. Abrar, I wanted to ask you, we're getting, I'm told, a lot of questions about cruises. And I realize this is a tricky one, again, because you're not necessarily in the travel industry, but I'm curious what your thoughts are about cruises.
Yeah, thanks, Chris. And I realize I didn't answer your other question, but I actually do agree with this idea of the summer, where there likely will be lower transmission. And I think by the Biden administration's estimates, around 75% of the country, hopefully by July, may be vaccinated here. So I think both of those things will contribute to Americans feeling safer to start to interact socially, which is important, of course, and also will probably feel safer to travel. The question again becomes how much vaccine are other countries receiving? But if other countries are not receiving vaccines and they also are not receiving the economic benefits of the tourism industry, then they're being hit twice as hard with both of those things. So I think it's a complicated issue. Cruises. The problem with cruises, I think, as many people are probably thinking, is that you're all gathered together on the ship for an extended period of time. And so, as Jessica mentioned, the key actually here is that if you're using a testing strategy, it needs to be testing plus quarantining. But I think that, as more people get vaccinated, my guess would be that cruises will actually require documentation that you've been vaccinated before you'll be able to get on. I don't know if every cruise ship will do that, but I imagine that a number of them will, because it's obviously having a big outbreak on your ship is bad for your brand, bad for your company, et cetera.
Right.
And now that you've got people vaccinated where transmission is much lower and, severity of disease is much, much lower, I would guess that's probably where things are headed.
Okay. Yeah, I had read about a particular cruise line where they were essentially using it as a giant bubble. This was a European cruise line. And what they did was they tested everybody before they got on. They continued to test every day, and they would have excursions. But in order to go on the excursion, you had to be together as a group. And they found a couple that didn't follow those protocols, and they got thrown off the cruise because they essentially broke the bubble of the cruise ship. So I think something along those lines will be coming down the pike.
Yeah. That was, that was one of our members. They had 16,000 people cruising in the Mediterranean. That was MSC, very successful. And they had testing before, of course, departure, and testing multiple times throughout the journey and creating bubbles, and no cases of COVID except those two that they didn't follow the rules, and they just, and did not allow them to board because they didn't follow the rules. But you're right. And I think the other thing with cruises, we just need to be very careful there. And I want to make a point here because, and we have been very vocal, if you require vaccination for traveling, you can discriminate and drive the wrong behavior. Because as the doctor mentioned, and you mentioned, Chris, some countries, they don't have access to the vaccination. And that means that we're going to have two types of citizens of the world, right? The first class that can get vaccination before you can travel. And the second class that because you're from a country that doesn't have access to the vaccination, you cannot travel. That's why I say we just need to be very careful, because this is not only for travel, this is going to be for everything, even employment. If you're competing for a job and I have exactly the same skills that I have, but if I was vaccinated and you haven't, chances are that I'll get the job and you will be discriminated. We just need to be very careful. In Europe, there are more rules to protect for that. But I think we need to be careful, especially between developing and developed countries. As you say before, some countries don't have access, and we can resume travel as long as we have the right protocols for international mobility, and we all respect that.
It's a very good point. Doctor, there is a question that's come in for you, which is someone is curious to know when they're traveling, how often should they be changing their mask? And I'll just throw in the question, which we've all been asking lately, about double masking. Are these things that folks should be doing? And also, I guess I should start off with the question about how often do we need to be changing our masks?
Yeah, I mean, it really depends on what kind of mask you're using. So there is a wide range of masks, anything from an elastomeric, which are really these industrial reusable N95s that you hardly will see, but some people are wearing them. Some health systems are using them, to medical grade masks like N95 masks and surgical masks. We usually will use those kind of once per shift or once every couple of days with some of the N95s, depending on the supply issues. But the actual data in terms of how long you can use those masks is quite mixed. And so I would recommend, if you're using a cheap surgical mask, using a new one every day. And if you're using a higher grade filtration mask, probably every few days, and maybe try to rotate them out and give them some time to sort of dry out, not let too much moisture accumulate. In terms of cloth masks, those, the filtration generally is not as good and the fit is very variable. Those masks, I would at least say that you should wash them, if not for COVID, just for the moisture and bacteria and other things that can build up. In terms of the double masking question, the theoretical benefit of double masking is improving the fit on your surgical mask. So surgical masks are made from actually similar material to N95 masks, which is a melt blown polypropylene non-woven material that can actually stop small particles from entering. They're very good masks, but there's a lot of leakage around the sides of the mask and near the nose. And so some experiments have shown that when you wear a cloth mask over that has a tight fit, you get a better filtration. So you're actually breathing through the filter rather than around it. So that's the idea behind the double masking.
Great. Jessica, I wanted to ask you, in your travels, have any of your friends shamed you? Have you experienced travel shame from people? Because, I think the shame is real. I get it from my husband, so I can only imagine what you hear from people.
Yeah, the shame is real. I was actually reading some of the questions from people watching right now. And because someone said, well, why am I traveling? So it's not necessarily because I'm an influencer, because I actually haven't shared that much of my travels. I did share my domestic travels. And while I shared my travels, I showed myself testing. I'm always wearing masks and things of that nature, because again, I do think we are able to do things in a safe way. So I only actually was shamed once, and that was really in the beginning, but I haven't actually been travel shamed. And again, I think it's because I'm showing how you can do it in a very safe way. If I go to a hotel, I show the protocols that the hotel has. And so by showing that, I'm sort of, hoping to help people feel more comfortable. So for sure, there are people who are afraid and will not travel and will continue to shame people. But I think at the end of the day, and to Dr. Karen's point, it's about a risk assessment, right? I don't see my mother. If I do see my mother, I'm wearing a mask, but I don't see her very often at all. I live alone. So if I go out and I come back and there's anything wrong, I can quarantine in my home by myself. So for me, I've done all of these risk assessments. Also, another thing, someone asked about traveling economy versus first class on flights. I have chosen to fly first class on most of my flights because there is greater distance between you and another person. So depending on your economic situation, that's also a way to feel more safe, right? Because at the end of the day, it is about making ourselves feel more safe, and we're hoping we're being safe, but this is such a variable virus, and there's so many factors into whether or not you're going to get it. My sister got it. She lives with my mom. My mom never got it. So, it's all very difficult, and we all have to do what makes sense for us. For me, there's also the balance with mental health. I live alone.
Right.
I live alone in a 625 square foot apartment. So someone who lives with someone else can sit and say, Jessica, you shouldn't travel. It's not safe. But you've not been living alone in a tiny box. So for me, like, travel is my life, So I went from 2019, 170 flights to 2020, 44, which of course someone is like, that's still a lot of travel. Yeah, but it's a drastic change for me in my lifestyle. And my mental health was being challenged. And I did what I needed to do to make sure I come out on the other end.
Right, exactly. Gloria, this is a good question for you as well. as someone who travels extensively, how did 2020 affect your mental health? I mean, aside from seeing sort of your world crumble around you, was it difficult to sort of stop travel, or was it a vacation for you to stay home?
Well, it was kind of difficult, but then on top of everything, I had a family emergency. And what it was more complicated was the changing of the rules from governments, to tell you the truth, and the uncertainty. I don't feel unsafe traveling. I feel totally safe as Jessica. I follow the rules. I wear the mask, as the doctor mentioned. I follow the protocols. But what's really frustrating is when you have these rules changing, and then suddenly you have to travel for family reasons, right? And in that case, it's really a complicated situation. So I love to travel. I have traveled all my life. I chose this job and this sector. It was not my career, but because of the passion. But the most important, because it has a purpose. It helps so many people and brings so many opportunities. I have the chance to see that firsthand, that you say, you know what, I feel good when I also travel, that you're making a difference and impacting in a positive way so many lives and so many people. So, but it is also frustrating from your mental health, the stress that it was created, and in many cases unnecessary, because unfortunately the countries were not working together. There's still some challenges. They don't talk to each other. They don't share best practices. And that's kind of a complicated situation. I really hope that we can get this right and we can move forward and find the right exit strategy. And as I said before, learn to coexist so that we can have the mental health, because it's not only not able to travel, it's the stress that it was created, in many cases unnecessary, especially in some parts of the world.
Yes, I completely agree. And Jessica, I completely agree about mental health as well. For someone who has spent the last 5 years traveling extensively, to suddenly have my wings clipped has been a challenge indeed. Dr. Karen, I wanted to ask you about modes of travel. What we've heard over the past year is that, the ventilation in airplanes is surgical room grade, all of that. My concern has always been getting in the Uber, that trip to the airport, getting to the airport, going through TSA, security, all of those things, the things that aren't medical grade filter. So in terms of air travel, there's also been questions about particles, like should you use the bathroom in an airplane? And then beyond that, what do you feel is the safest mode of travel?
Thanks, Chris. I would say a couple of things. One of the points that I've been trying to bring up just very pragmatically throughout the year is give people the tools to be safer. So just saying wear a mask over and over again, well, that's not good enough. So one thing that I was tweeting about earlier in the summer was open your windows when you're in an Uber. The ironic thing is, one of the Ubers that I took, the person wouldn't let me open the window. Luckily, it was just a short drive to the hospital, 5 minutes, but he said it's too cold outside. I'm not going to let the warm air out. I had my mask on, and it was hard to have a conversation about this. But the point is, for the vast majority of time, you can do small things that actually will have a big impact and will help to reduce the risk of transmission. When you go into the airport, yes, you are indoors and the ventilation is not as good as it's going to be on the airplane, but you can avoid crowds. You can keep your distance. You can keep your mask on, keep it on in the bathroom. It is not that straightforward to figure out exactly how much transmission is happening on flights. The reason is this, that to actually say that this transmission happened on the flight and not before the flight or after the flight, you need to actually do what some countries had done early on, and what had happened in the New Zealand outbreak I talked about, which is that people are quarantined after the flight, and then you're testing them, and you tested them before the flight, and then you use genomic surveillance to say, okay, the cases that we are detecting, are they all sharing a similar virus lineage? Are they from the same people that were sitting close to each other? Can we piece this together to say this likely happened on the flight? It's not that easy to do that. And when you're flying into the US, that doesn't happen. You get out of the airport and you just go wherever and nobody follows up with you. So I would say that we don't know exactly how much transmission, but there are a lot of reasons to suggest it's not that much, and that there are riskier places where transmission would happen than on an airplane.
Right.
the fewer people that you're around, the better. So if you can drive somewhere, that's great. You know, if you're going to be on a train, if you can figure out a time where it may be less crowded than more crowded, that's great too. All of these small things that you can do matter. But most importantly, I think is making sure you have a really good mask on. I mean, if you have a very high grade mask on that is fitted and you're getting like 95% protection, I mean, that's the level of protection you're getting with our best vaccines, right? And so fundamentally, that can actually really stop transmission. And if two people are wearing high grade masks, even if one of them is infected, the chance that they infect the other person is very low because you have source control on the infected person and a great mask on the other person. So that's actually one of the reasons why myself and colleagues have been pushing for getting the public better masks than sort of these poorly fitted cloth masks that we've been using all year. So those are a couple of thoughts. I do want to make one comment. As a clinical doctor, I've been treating patients all year. Yes, I've been seeing a lot of COVID patients. I've also been seeing a lot of patients who are suffering from mental health effects, suicidality, reversion to alcoholism, lost their job, homeless, et cetera, et cetera. I mean, people are really suffering. And so when people tell me that, oh, I'm shaming somebody because they did this or did that, I said, well, you know, I'm treating patients and you would have no idea what they're going through if you just judge them by the outside. Oh, this person went and I saw them socializing with someone else. People have shown over and over and over that socializing is not a luxury, it's a necessity. We need it for our mental health. We can only do this for so long. And this is actually why we need smarter public health. So in LA last week, when the Super Bowl was playing, it was 70 degrees outside and it was sunny, and they'd opened up outdoor dining, but then they said no TVs are allowed to be on. And so guess what happened? A lot of people just watched it at home with indoors rather than doing something outdoors and maybe having some crowd control, et cetera. We need to do smarter public health that's meeting people where they're at.
Interesting. Also, you know, to that point, with being smarter, with being outdoors, you know, when I was watching the Super Bowl and I was watching the parade in Tampa, and so many people were unmasked outside, obviously when you're outside, you have a better chance of, you know, of not catching the virus. But is it generally, for instance, with dining, let's say I'm traveling and I go to a place and I choose to dine outside. I know a lot of people are still uncomfortable with dining out of their homes in general. Is outdoor dining, you know, with precautions generally safe?
Well, this again depends on a few factors because you don't have a mask on and you're close face to face prolonged time with somebody else. But if you're doing it with people that are only in your household that you're seeing anyways, then the risk is about the same as what you're dealing with. Now you're just outdoors. If you're doing with multiple people that are all vaccinated, again, you're outdoors and you have a lower risk of transmitting onwards. Now, if you're with a big group of people, not everybody's vaccinated, you're sitting close to one another, you're sitting next to somebody that's not vaccinated, yeah, transmission can happen, especially when high rates of community transmission are ongoing, depending on where you are in the country, certainly can happen. Again, it's risk reduction, but the problem with dining is that your mask is off.
Exactly.
Can I say something really quickly, Chris?
Yeah, of course.
Hey, sorry, I just wanted to jump in. And I just wanted to talk a little bit about like boundaries, because I think for me, that's been really important. And I found myself, if I'm in a hotel and there's one other person on the elevator and someone else is trying to get on, I'll say, hey, sorry, don't get on. I don't feel comfortable. And I think that is really important as well, because we can't police everyone, but we can certainly create a bubble around ourselves, our 6-foot bubble. And I think that people should feel okay vocalizing if they feel uncomfortable or removing themselves from the situation. I was at a friend's house recently. Again, I wanted to get out. I was the only one who kept my mask on the entire time, because I mean, they're all family. And I'm like, well, I don't know you. I mean, you know, I know them, but I'm like, I just want to keep myself safe. And I also, you know, there were parents there. So I'm also like, I want to make sure. So I kept my mask on, even though they said you can take it off. I'm like, I'm going to keep it on. And I stayed 6 feet away. So I think it's also really important that people feel comfortable and confident, like setting up their personal boundaries to sort of keep themselves safe.
Agreed. Definitely. I think that's very important. And I don't think people should be afraid to say to somebody, you know, do you mind stepping back? Do you mind putting your mask on? And I think people understand. I definitely do.
I took a Lyft ride and my Lyft driver wasn't wearing a mask. And I asked them to put on the mask and she refused. and I had her pull over because it was a 30-minute ride. So I was like, I'm not gonna sit here because I don't have to. So I just want people to feel really empowered to sort of draw the line where they need to.
Yeah, that's also a long period of time to be in a car. Gloria, let me ask you, there was a question that came in from someone expecting, and I realize this is another crystal ball question and they're impossible, but they're wondering if they have an international family vacation planned in 2022. Do you see things at that point of being a little more settled in terms of being able to go to different countries, to be able to cross borders, and also not worry about lockdowns happening as frequently?
Well, we hope that in the next couple of months to have an agreement, an international protocol agreement for this mobility, where, as I say, yes, the vaccination rollout is great, but we need to have clear rules for the testing, massive testing, contact tracing, and all the things that we need to continue doing in order to have our international mobility back. So absolutely, actually this year, we should see a lot of progress. Once the mortality is reduced in a lot of these countries, I think we will see a lot of changes. But what's crucial is for the countries to get aligned and have an agreement. We're working with multiple governments, and finally there seems to be a light at the end of the tunnel. There's some sort of agreement. So in March, we're hoping to see these rules, and then countries will start adopting them. And that's basically the rule to tell you, okay, you need to do a test before departure and perhaps another test on arrival if you're coming from a high risk destination, or just a test on departure and no test on arrival, or a test in the day number 5, as the doctor knows, because the incubation period that he can explain probably better than me. So there are multiple steps depending of based on the risk, but those have to be very clear rules. If we just talk about quarantines, if we just talk about corridors, if we just talk about blanket, especially quarantines or hotel corridors, and keep changing those, that was some frustration and creates a lot of uncertainty, and that's what is impacting the travelers. So for the person that is asking the question, absolutely, as I say, we're expecting a strong summer. Hopefully we'll bring back 100 million jobs of the 174 that have been impacted. But in order for us to do that, to rehire a lot of those people and be able to have those livelihoods back, we need to resume international travel. And the only way to resume international travel is to have this international cooperation and also have everyone following the protocols, wearing the mask, and the things that we have been discussing. I think it's very important, and we should all be part of the solution.
Definitely. Dr. Karan, I wanted to ask you about reinfection. Let's say somebody has COVID, they've gone through it, they've recovered. There was the perception that once you have had the disease, the virus, that you're immune for a few months after the fact, that sort of thing. Should people feel that level of security if they've done that, or is that by this point an old wives' tale?
Well, no, I mean, reinfection does happen. It's thought to happen less commonly within the 3 months after you've been infected. And that's actually where the CDC guidance comes in. You do have some level of antibody response that should protect you. And even thereafter, if you do get infected again, generally it will be a milder case of infection. You may not have symptoms. Now we're actually seeing viral variants, as you've probably heard of throughout the news. And this is, expected as the virus mutates and spreads to more people. It starts to develop certain advantageous changes that allow it to either evade the immune response or transmit more effectively. And we're still studying these and trying to understand these. Now, remember, it's not that easy to figure out if somebody had a true reinfection. The reason is this: if you get tested again and your PCR test is positive, it could be that you're still shedding virus, which people can do for weeks and weeks afterwards. Pretty rare for you to be shedding it for months and months afterwards. So what you'd need to do is actually look at the genome of the virus, sequence it to see if you have been infected with a different viral strain than previously. And so that's something that, we do, and that's how they were able to discover that people did get reinfected. But I would say that, after either getting vaccinated or being infected, for a few months thereafter, you should not expect to be reinfected. It should be uncommon.
While I have you here, some of our viewers there's been a common thread in comments and questions about, is it irresponsible to be traveling right now? The fact that we're talking about travel as something people can do, particularly with the variants that are out there. Should we, despite what we're talking about at this particular moment in time, this winter, buckle down and limit our travels?
Yeah, I mean, that's a great question. I think this really gets to the heart of what the priority right now is in the United States. And the key is this: earlier on, when we had locked down back in the spring, we did that to slow down the spread and make sure our healthcare systems could handle what was happening. Now we actually have another goal, and our goal is to vaccinate as many people as possible so that everybody can get back to a more normal life. Although, as mentioned, it will never be exactly the same as pre-COVID for a lot of different reasons. And the other thing is that as you do travel more, that is how variants spread. So, variants that we saw in the UK or in South Africa or from Brazil, I mean, travel is how the epidemic became a pandemic in the first place. This is globalization will make infectious diseases and pandemics something that will probably occur more commonly. So I would say that, it's a complicated decision. And the way I think about it, as a healthcare worker, most of my time is spent at the hospital taking care of people. And that's going to be the case, for quite a while. And it's going to be busy for quite a while with COVID. And so I personally try to only travel if needed right now, but I can also understand that the situation is different for everybody.
Exactly. Yeah, I think that goes back to family emergencies, mental health, all of those things. And as Jessica pointed out, what you feel your personal risk is when it comes to travel. I am told that we are getting close to the end of our talk, which is quite sad because I think I could continue talking about these things for another couple of hours. But before I let you all go, while I greatly have you here, I wanted to just kind of get some final thoughts from people as to kind of where we're headed right now in regards specifically to travel. And Gloria, why don't we start with you?
Well, I think our sector is very resilient. And when we talk about travel, I would say we need to talk about the impact in jobs, 1 in 10, the impact in communities, the impact in the livelihoods of the ones that have been affected and they don't even have food on the table, right? We can see this from our own perspective and of course, make our own decisions. But as I said before, if we can also travel responsible and help others, that might be a win-win situation. Well, like in the case of Jessica, that she has been traveling, or in my case, I live in the UK. The situation is very different perhaps here than in the US. But what I can tell you, a lot of the transmissions have been community to community, not traveling. Now, I agree with the doctor, we need to be careful. And unfortunately, perhaps only 5 or 10% of the population is not respecting the rules, but the other 90 are paying the consequences. The ones that they are not wearing the mask. I was in London, for instance, in central London before the lockdown, no one was wearing a mask. We had no social distance. And when you see those type of things, and there no one reinforcing the wearing the mask and the things that we have, then you have a very, the mutations, the strains, and all of that. So I would just say, we are all connected, and the only way to get out of this is to working together and everyone contributing. Travel is the backbone for trade. It's cheaper to invest in testing than paying and furloughs and also the different schemes that we have in this part of the world. And I'm sure in the US is happening as well with the checks and all of that. So, but in order for us to get out of this, it's crucial that we understand the different sides and we all contribute as well. We hope, as I say, to bring back the 1 million jobs impacted. The US is very fortunate to have the vaccines, but that's not everywhere in the world. So that's something also to consider when they make the decisions. And if they can travel and help others, that might be significant as well. Thank you.
Thanks. Thank you. Jessica?
Yeah, well, I want to just say, be kind to each other and be kind to yourself. I think that's really important. In the beginning, we were doing it. It's kind of, people are tired, but, just really continue to be kind to each other and be kind to yourself. Give yourself grace. It's a weird moment in time. No one really knows. truly what's going on. The other thing, wear your mask and social distance. And again, if you want to see which countries are open and what the requirements are, it's IATA, International Tourism. So just put that in Google and you'll get the map where you can see everything. But yeah, just continue to really be a good neighbor.
Yeah. Is it IATA.com if folks want
Well,
to
if you just, well, because you want to get to the exact page, if you just
Got it.
Google IATA International Travel, that page on their website will come up and you'll see an interactive map that shows all of the requirements to enter every country in the world.
Perfect, which I know people will find incredibly useful. And Dr. Karen, I know that we've put you on the spot a lot today, so I appreciate you listening to all of our questions. But for people who are thinking about traveling, what's your advice?
Yeah, Chris, thanks again for having me. Thanks so much, Gloria and Jessica. Everything you guys have been saying is so important. I would say that as individuals, there's a lot that we can do. Wearing a mask, physically distancing, testing, quarantining appropriately, getting vaccinated. I think those things are all crucial. They all reduce our risk of serious infection, reduce our risk of infecting other people. I think we need to think about our neighbor. Remember, there's a lot of people that don't have the luxury of traveling for fun. There's people that just need to travel to go see sick loved ones. A lot of people are frontline workers who can't travel at all. Some of these are frontline workers who are working in the travel industry who have not been vaccinated yet in different countries around the world. The more we can do to advocate for our most vulnerable, the more we can do to advocate for equitable distribution of this vaccine globally. I think those are parts that we all need to play. And so I hope that the travel industry actually can help with that, even help with some advocacy or putting a little bit of pressure to make sure that all of the most vulnerable workers in those industries get vaccinated and are protected and are paid extra for the time and the risk that they are taking. So for me, that's really the most important thing. You're on mute, Chris.
Thank you all so much for being here. This has been wonderful. And again, safe, wear your mask, use your hand sanitizer. Looking forward to continuing the conversation in future sessions, and have a wonderful afternoon. Thank you all for joining us. Take care.